From Washington is Democratic Senator from West Virginia, the inimitable Joe Manchin. Senator, thank you so much for joining us today.
Nice to be with you, Alex. How are you?
So, Senator, I want to get your take on this. There is a lot of talk about panic in Washington, and as a Democrat on the Hill, where do you stand today? How are you on the panic meter of 1 to 10?
I'm not too excited, and I don't get too panicked. We got to fix things. And that's what I came here to do. The people of West Virginia expect me to go and help make it better, and I'm going to do that. The bottom line is that they messed up. They messed up royally. There's no excuse for this, and I'm not here trying to make excuses. But I sure don't want to go back to what we had before, one serious or catastrophic illness away from bankruptcy, a child with a defect couldn't get on their parents, or someone with a pre-existing condition couldn't get insured, or someone who was too sick said their only option was to die, I guess. That's not who we are as Americans. This thing is messed up. Can we fix it? Absolutely, if we work together, but my goodness, it seems like everyone's working against each other right now, not even wanting to see if we can get a better health care delivery system that's affordable and accessible.
Senator,
we've got to work.
Now, we know that Democrats have been on the front lines in this battle, and a few weeks ago, or even a week ago, there was talk on Capitol Hill that the White House had really not done well, that had not done well by their soldiers in the field, if you will. And there was a sense of Democratic frustration. In the intervening days and weeks, folks have said the White House needs to have stronger contact and connections with their party on the Hill. And I know a few days ago on this channel you said you hadn't really talked to the president. Do you feel like the outreach from 1600 Pennsylvania Avenue has gotten better, or basically stayed the same in the last few days?
You know, it is what it is. Dennis McDonough's reached out, and we've talked to Dennis on different things. He's straightforward. I trust him. It's good to work with. But with that, everybody has their own style. You know, everyone's making so much of this thing. We have a system that we've got to fix. It's not working. We're shoppers. You know, we're the best consumers in the world. Create that website so I can shop it.
Yeah.
Let me shop a little bit. Don't tell me I got to buy it and find out what I'm getting. Let me go out and compare. You know, I'm looking right now. I've got to make decisions for myself by December the 9th. Do I go with a DC exchange? Do I go Medicare? What's my options? So I like to be able to have all the information in front of me. When you go on Amazon, if you're going to buy a tie, pretty easy to shop. I can shop many places. Why can't I shop this?
Senator Manchin, I love to hear you extol the virtues of online tie shopping. I want to bring in our folks here in New York. Howard, you've been talking about how you think the president needs to wage a third campaign, and he himself has said, you know, this is the last campaign of my tenure as president. He was on the phone with his OFA foot soldiers last night. What else do you think he needs to do if this is in fact a campaign?
Well, he needs to frame things just the way Senator Manchin just did. Number one, explain why we got into this in the beginning, the why of it. I think there's really been, you've got to fix the mechanics, but you have to re-explain the why of it, what the problem was, what they were trying to fix, what good things have already been accomplished for millions and millions of people in terms of getting rid of denial of pre-existing conditions, extended lifetime limits, all that stuff. And you have to explain it in the kind of personal, vivid detail that Bill Clinton was so good at doing. Nobody could explain the virtue of a government program the way Bill Clinton could, because he spent many years defending the idea of government in Arkansas in the South, and he knew how to swim upstream against that tide. President Obama needs to do more of that. That's why I think he needs some of his people back. He needs some of his campaign people back, I would even say, to help him do that. That's number one. Number two, he's got to be with the leaders of Congress more. He just has to do it. I know Senator Manchin says it is what it is, but it doesn't have to remain what it is, because the Democrats' fate is inextricably tied to health care. There's no going back. There's no going back for the Democrats on this. They can stop calling it Obamacare and now call it the Affordable Care Act, and we're not going to mention Obama again. Baloney.
I think we should call it
the nation's, to fix it. They have a year to fix it.
It's the nation's health care law. It's a law intended to give everybody in this country access to health care.
Also, the shopping thing he said is brilliant. And the fact is that the way the site was set up, you have to give all your information before you can shop.
So much is contingent on the website, unfortunately. But Heather, I mean, I think we can't get away from the facts here. And I keep going back to the this thing that John Boehner said last week, which was, we have the best healthcare delivery system in the world. And it is not a mystery that we do not have the best healthcare delivery system in the world. There's studies from the Commonwealth Fund that came out yesterday. 37% of American adults went without care or didn't see a doctor when they were sick, or they failed to fill their prescriptions. That's more than a quarter of this country. That's more than 1 in 3 Americans. You can't tell people that this is the best healthcare delivery system in the world.
And just shrink it down to the one thing that they've been writing on, which is this, cancellation of these plans. These healthcare plans, which affected a minority of people who are on the individual market, were terrible plans. They weren't plans, they were scams, right? You pay your insurance premiums every single month, and then you actually get sick, and you don't have the consumer protections that everyone from a Consumer Reports to Angie's List or to Amazon.com, to try to use that same analogy, would have said, this is a badly rated plan. And we actually had the government saying, you know what, insurers, you can't rip people off anymore. And now suddenly John Boehner is acting like he's actually the #1 insurance provider in the country.
Senator
and wants to give
Manchin,
people these health care.
I want to ask you about that narrative around these, these folks who were on individual insurance plans and got cancellation notices. Have Democrats ceded too much ground to Republicans on that issue and not answered more forcefully with the statistics at hand relating to all the millions more Americans who are getting helped by this law?
Alex, we can talk about the things and how much better it would be if you didn't have these other types of plans. The bottom line is the president said, if you have it, you can keep it. We need to honor that. Now, what we need to do also is be able to let them go on and simply shop to see how much better they can get for about the same money, sometimes less money, maybe $50 more, and make a decision. Again, we're the best shoppers in the world. I can make a decision if you're giving me great value. If you give me good value, and I want to pay a little bit more, I'll make that decision. But I'm not going to penalize you now, and I think the president, he said he wants to extend it for a year. Myself and Mary Landrieu said it should be extended. It should be extended indefinitely if you already had it. We're trying to get people that weren't insured. The next, and also I said...
Do you think insurers should be forced to extend it?
You mean the bill that we're trying to pass?
Yes.
Well, only thing what we're saying, our bill basically says that you can keep it. Now, I'm telling you, people will not keep an inferior product if they see something better. I know it's hard for people to understand that, but that's who we are.
We are the best shoppers in the world.
You're the best shoppers. We all are. We're great shoppers, and we like to buy.
Senator, for just a moment, I'm going to bring in my folks in New York here, Jake, and we are the best shoppers in the world. But unfortunately, the place where we want to shop just doesn't happen to be up and running quite yet.
We're going to get there.
We are going to get there. We are going to be able to shop. But in the meantime, I want to ask you about this sort of... Beyond the panic, there's this new narrative that's emerging that the failure, the botched, bedeviled rollout is undermining the progressive argument for governance. And that's beyond, that's beyond this is Obama's Katrina. That is, liberals, Democrats are going to be feeling this pain for some time to come. I think that's an overreaction, but I'm curious to know what you think.
I agree with that. I think not that that's happened, but those are the stakes. This is the biggest thing government has tried to do in decades, since the Great Society. It is reforming a massive part of the American economy, a sixth of the American economy. It's incredibly hard. But if the president can't make the website work, if he can't catch up on the sign-up numbers, it is going to discredit not just the idea of health care reform, but the idea that government is capable of doing big things. And that's why, with respect to my friend Howard, I don't think this is about explaining it better, telling a better story, waging a better campaign, having a better war room. I think it's about execution. This was a flop. It was sabotaged not by its opponents, but by its well-meaning supporters. And they've got to get it working. And getting it working, now whether the deadline is 30 days or 60 days or 90 days, I'm not sure. I think there will be, if it is made to work, people will possibly look back on this period and say, it was a big deal, it was rocky.